You felt it, that half-second delay when your legs didn't respond the way they used to. That wasn't age. That was your blood already slowing down, getting thicker, making every step harder without asking permission. And what's worse? Most people don't realize this is happening until walking becomes a struggle. But what if the real problem isn't your legs at all? What if it's something moving inside them right now? If you're serious about taking better care of your health, make sure you subscribe. I share simple, practical advice designed especially for seniors. And feel free to leave a comment telling me where you're watching from. I appreciate every one of you. Let's get back to it. There's a moment that sneaks up on you. You push yourself out of your chair, and your legs respond a half-second slower than your brain expected. You're walking a route you've done 100 times, and somewhere in the middle of it, your feet start to feel like they're carrying extra weight that wasn't there last year. You get home, sit down, and your legs just feel done, heavy, thick, like they ran a race your mind never agreed to. And you do what almost every person over 60 does in that moment. You chalk it up to age. Reasonable assumption. Completely wrong conclusion. Because what you just described isn't your muscles giving out. It isn't your joints wearing down. What you described is your blood right now, today moving through your legs with less efficiency than it used to. Not blocked, not diseased. Just slower, thicker, and working harder to deliver what your legs are asking for. That one distinction changes everything about what you do next. Here's something that rarely comes up in a standard doctor's visit. Circulation doesn't decline all at once. It doesn't announce itself with chest pain or a dramatic event. It retreats quietly over months, over years, through a process happening at a microscopic level inside your blood vessels. Nitric oxide production gradually drops. Blood vessel walls slowly stiffen. And your blood, the actual fluid moving through those vessels, begins to thicken in ways that make every beat of your heart work just a little bit harder than it should. A study published in the Journal of Nutrition found that this kind of vascular efficiency decline begins earlier than most people expect and progresses silently long before symptoms become impossible to ignore. By the time most people pay attention, the easy window for natural correction has already been shrinking for years. That's the part nobody talks about, and it's exactly why I made this video. My name is Dr. James Cross. I've spent years studying how circulation changes after 60, not the catastrophic changes that land people in hospitals, but the quiet, gradual shifts that steal distance from your daily walks and replace your evenings with fatigue you can't fully explain. And what I've found is that one specific, largely overlooked oil has a direct and measurable effect on how easily blood moves, not just on the vessels carrying it. The research on this is more compelling than most people realize, and the timeline for results is faster than almost anything else in this category. But before I get into any of that, I need you to be honest with yourself for a moment. Right now, thinking about your legs, which one word fits? Heavy, cold, tired. Type it in the comments below, because each of those words points to a slightly different place where your circulation is losing ground. And what I'm about to show you addresses all three in a very specific way. So you typed your word. Heavy, cold, tired. Whatever you chose, hold on to it. Because by the time this is over, you're going to understand exactly why your legs feel that specific way. Not in vague, general terms. In a way that actually makes sense of what your body has been trying to tell you. Let's start with something most people never visualize. Right now, running through your legs, there are thousands of blood vessels, not just the large ones your doctor checks, but an entire hidden network of tiny capillaries, so small they can only carry one blood cell at a time. This is called your microcirculation. And it is responsible for delivering oxygen and nutrients to every muscle, every nerve, every inch of tissue in your lower body. When your microcirculation is working well, your legs feel responsive, light, capable. When it starts to decline, and after 60, it almost always does, the first signs aren't dramatic. They're the exact words you just typed. Here's what's happening at the biological level. As you age, the inner lining of your blood vessels, called the endothelium, begins to lose its ability to produce a molecule called nitric oxide. Nitric oxide is what keeps your vessels relaxed, flexible, and open. It's essentially your body's natural signal telling blood vessels to stay wide so blood can pass through easily. When nitric oxide production drops, vessels begin to stiffen. They become less responsive to the demands your muscles are making. A peer-reviewed study in hypertension confirmed that endothelial nitric oxide production declines measurably with age, and that this decline directly correlates with reduced blood flow to peripheral tissues, including the legs. Think of it like a garden hose left out in the cold. The water is still there. The pressure behind it hasn't changed, but the hose itself has stiffened, and suddenly the water moves differently, slower, less freely, with more resistance at every bend. That hose is your vascular system after 60. But here's what makes this more complicated and more important. Even if your large arteries are relatively clear, circulation can still be significantly compromised, because the problem isn't always blockage. Sometimes more often than most people realize, the problem is something else entirely. Something happening inside the blood itself, not just the vessels carrying it. This is the piece almost no one talks about. And it's the reason why people can do everything right: exercise, eat reasonably well, avoid the obvious risks, and still end their days with legs that feel like they've been filled with sand. Your circulation isn't just about where blood travels. It's about how easily it moves when it gets there. And that difference, that single overlooked factor, is exactly what we need to talk about next. So if it's not always blockage, what is it? That's the question most people never get to ask, because the conversation about circulation almost always stops at arteries. Are they clear? Are they narrowed? Is there plaque? Those are the questions that dominate checkups, that drive prescriptions, that fill health segments on the evening news. And they matter. They absolutely matter. But they're only half the picture. The half that gets left out, the half that explains why your legs still feel heavy, even when your last scan came back relatively clean, comes down to something called blood viscosity. In plain terms, how thick your blood is, how easily it moves, how much resistance it creates with every single beat of your heart. Here's the simplest way to understand it. Imagine two liquids flowing through the same pipe diameter, same pressure behind them. One is water. The other is a thick syrup. Which one moves faster? Which one delivers more to the end of the pipe with less effort? The answer is obvious, and your circulatory system follows the exact same physics. When blood becomes even slightly thicker than optimal, it creates friction against vessel walls. It moves more slowly through narrow capillaries. It forces your heart to work harder just to maintain flow. And at the far ends of your circulation, your feet, your calves, your lower legs, the delivery of oxygen and nutrients quietly drops below what your tissues actually need. You feel that as heaviness, as coldness, as a fatigue that sleep doesn't fully fix. Now here's what drives blood viscosity up in the first place, because this is where it gets specific. One of the primary culprits is a protein called fibrinogen. Fibrinogen is produced by your liver and plays a role in clotting, which is useful when you're injured. But when fibrinogen levels run chronically elevated, it thickens the blood in a way that has nothing to do with clots or blockages. It simply makes blood stickier, denser, and harder to push through your microvascular network. A landmark study published in Circulation, one of the most respected cardiovascular journals in the world, found that elevated fibrinogen levels were independently associated with reduced peripheral blood flow and increased risk of circulatory symptoms in older adults, independent of cholesterol, independent of blood pressure, independent of the usual suspects. That's significant, because it means your standard blood work could come back looking acceptable while your fibrinogen is quietly working against your circulation every single day. And fibrinogen isn't the only factor. Chronic low-grade inflammation, which becomes increasingly common after 60, also raises blood viscosity by altering the shape and flexibility of red blood cells themselves. When red blood cells lose their flexibility, they have more difficulty squeezing through the smallest capillaries, the ones in your legs, the ones responsible for that last-mile oxygen delivery your muscles depend on. This is the hidden layer of the circulation conversation. Not the dramatic blockage, not the emergency, just a slow, silent thickening happening in the background, day after day, that gradually raises the cost of every step you take and every hour you spend on your feet. The good news, and there genuinely is good news here, is that blood viscosity is not fixed. It responds to specific inputs. It can shift. And one particular oil targets this exact mechanism in a way that is both scientifically documented and remarkably simple to act on. That's exactly where we're going next. So now you know what's actually happening. Your blood vessels are stiffening, nitric oxide is declining, fibrinogen is quietly thickening your blood from the inside, and the cumulative result is a circulatory system that's working significantly harder to deliver significantly less to your legs than it used to. The natural next question is, what do most people do about it? And the honest answer is, they try the right things. They genuinely do. They walk more. They cut back on sodium. They take the medications their doctor recommends. They buy compression socks and elevate their legs at the end of the day. And some of that helps. Partially. But here's the frustration nobody prepares you for. You can do all of those things consistently and still end your evenings with heavy legs. Still wake up with feet that take too long to warm up. Still notice that your walking distance has quietly shrunk over the last 2 years without any single dramatic reason you can point to. That's not a failure of effort. That's a failure of targeting. Because most common solutions address the vessel, but none of them directly address the blood moving through it. Take exercise. Walking and movement genuinely improve cardiovascular health over time. They encourage nitric oxide production and help maintain vessel flexibility. But the timeline is slow. The benefits build over months. And for someone whose blood viscosity is already elevated, the immediate circulatory resistance doesn't drop just because you added a daily walk. The underlying thickness remains. Take compression garments. They work externally, pushing blood upward against gravity, reducing pooling in the lower legs. Useful. But the moment you take them off, the blood behaves exactly as it did before. Nothing internal has changed. Take medication. Depending on the drug, benefits can be meaningful, particularly for blood pressure or clot prevention. But standard cardiovascular medications are not designed to optimize blood flow dynamics at the microvascular level. They target specific pathways. The viscosity problem, the fibrinogen elevation, the reduced red blood cell flexibility, these often sit outside what a standard prescription is aimed at. Here's the gap nobody names directly. Most interventions treat the structure of your circulation. Very few treat the behavior of your blood itself. And that gap, that precise, overlooked space between vessel health and blood flow quality, is exactly where the solution we're about to discuss operates. This isn't about replacing what you're already doing. Your walk still matters. Your medications still matter. Your doctor's guidance still matters. But if you've been doing everything right and still feel like something is missing, this is what's missing. One specific oil, one targeted mechanism, working from inside your bloodstream in a way that nothing external can replicate. And the science behind why it works is more straightforward than you'd expect. So what is it? After everything we've just walked through, the viscosity, the fibrinogen, the microscopic resistance building quietly inside your circulation, what actually addresses that specific problem at its root? Not a medication, not a complicated supplement stack, not a procedure. Oil. One that's been sitting in nutrition research for decades, quietly accumulating evidence while trendier solutions grab the headlines. Flaxseed oil. Before you dismiss it, hear the mechanism, because this is not about general wellness or vague anti-inflammatory benefits. The reason flaxseed oil matters specifically for circulation, specifically for people over 60, specifically for the problem we've been describing, comes down to its molecular composition and what that composition does inside your bloodstream. Flaxseed oil is the richest plant-based source of alpha-linolenic acid, an omega-3 fatty acid, commonly referred to as ALA. And ALA does something very specific that directly targets the circulation problems we've been discussing. Here's the first mechanism. ALA has been shown to reduce circulating fibrinogen levels. Remember fibrinogen, the protein that thickens your blood and raises resistance throughout your microvascular network? A study published in the American Journal of Clinical Nutrition found that omega-3 fatty acid supplementation, including ALA, from flaxseed, produced measurable reductions in fibrinogen concentration within weeks of consistent use. Lower fibrinogen means less internal blood thickness. Less thickness means lower resistance. Lower resistance means more oxygen reaching your legs with less effort from your heart. That is not a vague benefit. That is a direct, documented, physiological shift in how your blood behaves. Here's the second mechanism. Flaxseed oil has significant anti-inflammatory properties at the vascular level. Chronic low-grade inflammation, one of the defining biological features of aging, damages the endothelial lining of blood vessels and further reduces nitric oxide availability. ALA interrupts this inflammatory signaling by influencing the production of prostaglandins and leukotrienes compounds that either promote or suppress vascular inflammation, depending on which fatty acids are available in your system. A study in atherosclerosis demonstrated that flaxseed oil supplementation improved endothelial function markers in participants with cardiovascular risk factors, meaning the vessel lining became more responsive, more capable of dilating when blood flow demands increased. Your vessels start behaving younger, not metaphorically, measurably. Here's the third mechanism, and this one surprises most people. ALA directly influences the flexibility of red blood cells themselves. Research has shown that omega-3 fatty acids incorporate into red blood cell membranes, making them more pliable, better able to squeeze through the narrowest capillaries where oxygen delivery matters most. This is called improved blood rheology, and it is one of the most underappreciated factors in peripheral circulation quality. Stiffer red blood cells struggle through tight capillary bends. More flexible ones glide through. The difference shows up in how your legs feel at the end of a long day. Now, you may have heard that ALA conversion to EPA and DHA in the body is limited. That's true. The conversion rate is relatively low, but here's what that talking point misses entirely. ALA does not need to fully convert to produce these circulatory benefits. Its direct effects on fibrinogen, endothelial function, and red blood cell membrane flexibility operate independently of that conversion pathway. It works as it is, right from the first tablespoon. Not trendy, not overhyped, just quietly, specifically, measurably effective for exactly the problem your legs have been carrying. And how fast does it work? That's what makes this genuinely different from almost everything else in this space. That last question deserves a real answer, because in the world of natural health interventions, how fast is almost always the uncomfortable part. Most legitimate solutions come with an honest but discouraging timeline. Months of consistency before anything noticeable shifts, a year before the numbers move meaningfully. And for someone whose legs already feel heavier than they should, that kind of timeline is hard to commit to. Flaxseed oil is different, and the reason comes down to what it's changing. Think about the difference between remodeling a building and changing what flows through its pipes. Most cardiovascular interventions work on the building, the vessel walls, the arterial structure, the long-term architecture of your circulatory system. That kind of change is real and valuable, but it is inherently slow. Structural repair takes time. Tissue remodeling takes time. You cannot rush biology at that level. But blood viscosity is not structural. It's compositional. It's a property of the fluid itself, and fluids respond faster than structures do. When you introduce something that directly reduces fibrinogen concentration, that lowers inflammatory signaling at the vessel wall, and that improves red blood cell membrane flexibility, you are not waiting for tissue to rebuild. You are changing the behavior of a moving liquid, and that shift can become measurable in a significantly shorter window. The research reflects this precisely. A study published in the European Journal of Clinical Nutrition tracked inflammatory and viscosity markers in participants supplementing with flaxseed oil daily. Within 3 to 4 weeks, researchers observed statistically significant reductions in fibrinogen levels and improvements in endothelial responsiveness changes that translated directly into improved peripheral blood flow indicators. 3 to 4 weeks, not 6 months, not a year. That's the window where people begin noticing something is different. A walk that feels slightly less effortful. Legs that don't carry that familiar heaviness quite as heavily by evening. Feet that warm up faster in the morning. Small signals, but consistent ones. And in circulation, consistency of signal means the underlying mechanism is genuinely shifting. Now here's the part that matters for long-term results. That early improvement is not a ceiling, it's a starting point. The 3 to 4 week window reflects the initial compositional shift in blood behavior. But as consistent use continues, the anti-inflammatory effects on the endothelium compound, nitric oxide availability gradually improves. Red blood cell flexibility continues to optimize as ALA incorporates more fully into cell membranes over subsequent weeks. The early results get you believing. The sustained results are what actually change your daily life. This is also why consistency matters more than quantity here. A large dose taken occasionally will not produce what a moderate, daily dose does over time. The body needs a steady supply to maintain the shift, not a dramatic intervention, but a reliable one. Which brings us to the only real question left. Exactly how do you take it, and what do you need to know to make it work? So you're convinced the mechanism is real. The fibrinogen reduction, the endothelial improvement, the red blood cell flexibility, the 3 to 4 week window where something measurable begins to shift inside your circulation. All of that is documented, specific, and directly relevant to what your legs have been experiencing. Now comes the part that either makes all of that science useful or lets it sit as interesting information you never actually acted on. The protocol. And here is where I want to be very deliberate. Because one of the most common ways people fail with nutritional interventions isn't skepticism, it's overcomplication. They read about something that works, and then they bury it inside a routine so complex, so crowded with other additions and modifications, that consistency becomes impossible within 2 weeks. That is not what this requires. What the research supports, and what produces the circulatory benefits we've discussed, is straightforward enough to fit inside a single sentence. 1 tablespoon of cold-pressed flaxseed oil taken once daily, with food. That's the protocol. Let's make sure you execute it correctly. Cold-pressed matters. The refining process used in lower-quality oils destroys a significant portion of the ALA content and strips out the polyphenols that contribute to the anti-inflammatory effects. Cold-pressed preserves the full molecular profile that makes flaxseed oil biologically active. Check the label before you buy. Take it with food. ALA is a fat-soluble compound, which means absorption is meaningfully improved when consumed alongside a meal that contains some dietary fat. It doesn't need to be a large meal. Breakfast works well for most people. The habit anchors more reliably when it's attached to something you already do every morning. Never heat it. This is non-negotiable. Flaxseed oil has a low smoke point and oxidizes rapidly under heat. Cooking with it doesn't just reduce its effectiveness, it produces oxidized lipids that actively work against the vascular benefits you're trying to create. Take it straight from the spoon, blend it into a smoothie, or drizzle it over food that's already been cooked and cooled slightly. Never into a hot pan, never into hot food. Store it properly. Flaxseed oil degrades quickly when exposed to light, heat, and air. Buy it in a dark bottle. Keep it refrigerated after opening. Check the expiration date, and don't use it past that point. Rancid oil carries none of the benefits and introduces oxidative stress instead. 1 tablespoon, once daily, cold pressed, with food, refrigerated. No stacking required, no complicated timing windows, no expensive delivery systems, just consistency applied to the right intervention, at the right dose, maintained long enough for your blood to reflect the change. A landmark review in Nutrients confirmed that adherence to a simple, single-intervention protocol consistently outperforms complex multi-supplement regimens for producing measurable circulatory outcomes in older adults. Consistency beats complexity. Every single time, you made it here. And that already tells me something about you because most people don't. Most people catch a few minutes of a video like this, get pulled away by something else, and file it under, interesting. I'll come back to that. They never do. Life moves fast, attention is short, and good information gets buried under everything else competing for the same 30 seconds. But you stayed, which means you're ready to hear the part that matters most. Everything we've covered, the microcirculation, the fibrinogen, the nitric oxide decline, the red blood cell flexibility, the specific mechanism of flaxseed oil, and why its timeline is faster than almost anything comparable. All of it points to one conclusion that most people never fully accept about their own bodies after 60. Your circulation is not finished adapting. That bears repeating, because it runs directly against what most people silently believe. The assumption underneath every dismissed symptom, every heavy leg chalked up to age, every cold foot accepted as permanent, every shortened walk quietly surrendered to, is that the body, past a certain point, has stopped listening, that the changes are locked in. That biology has made its decision, and your job now is simply to manage the decline as gracefully as possible. That assumption is wrong. Your endothelium is still producing nitric oxide, just less of it than it used to, which means the pathway still exists and still responds to the right inputs. Your red blood cells are still replacing themselves on a cycle of roughly 120 days, which means every few months, your blood has an entirely new population of cells, whose membrane flexibility can be directly influenced by what you're consistently putting into your body. Your fibrinogen levels are not genetically fixed. They fluctuate in response to inflammation, diet, and the specific fatty acid profile you maintain over time. These are not closed doors. They are slow-moving ones. And flaxseed oil, 1 tablespoon, cold-pressed, taken daily with food pushes on exactly the right ones. A study in the Journal of the American College of Nutrition found that consistent omega-3 fatty acid intake in adults over 60 was associated with measurably better vascular responsiveness compared to age-matched controls, who did not supplement regardless of other cardiovascular risk factors. Your body is still listening. It has been this entire time. The question was never whether improvement was possible. The question was always whether you were giving your body something worth responding to. Now you are. 1 oil, 1 tablespoon, 1 decision made consistently every morning with your first meal, before the day has a chance to convince you that you've already done enough. That's not a complicated ask for what it gives back. Your legs carried you this far. Give them what they need to carry you further. Thanks for watching all the way through. Staying informed is key to living a healthier, longer life. If you want more simple, practical health advice, make sure you subscribe and tap the next video on your screen. And before you go, leave a comment and rate this. From 1 to 10, your feedback helps me create better guidance for you.